Hey everyone, this is Daniela from the Obstacle Doc, and today we're talking about soft tissue massage and ways for you to do that at home. So a lot of the times we'll hear people trying to foam roll or trying to aggressively massage their tissue. While that might work for some people, that's not usually our prescribed way of treating the tissue. When we're looking at the amount of force and power that comes through the spine when we have those areas of tension, we're really trying to create some discomfort without pain so that the muscle does not contract further down. When we're in pain, usually the muscles kind of eke away. So we're trying to get them to release. So we're going to work with them. The way that we like to do it for the spine and then for the muscles around the spine particularly is with a tennis ball, lacrosse ball. This is two tennis balls taped together, so what some people call a peanut. The reason for this is when you look at the spine, you have that protrusion, so your spinal process that kind of goes in this nook. So the spine, the middle of the spine is going to go here. And then what's really nice is that the balls fall on either side, which is where you have some of those deep multifidi muscles and then some of the other paraspinals as well. So we like to do this on the wall because of that load issue. We don't want to put so much pressure through the spine, through the muscle that it gets really, really painful, especially if it's more sensitive or if it's post-op. So we're going to take peanut, we're going to go spine right between. So if I find my bony bumps here, I'm going to go right between, and I'm just going to take that to the wall. So I'll take a couple of steps away with my feet, and I can just find whatever pressure point. I can also roll up and down until I find the area that I'm looking for, and then you can hold. So a couple of things that you can do is stay here, just hold and breathe, right? We're trying to get those muscles to relax and to lengthen. So thinking of deep diaphragmatic breaths, just kind of hanging out more or less. This is not a wall sit. We don't need to load the rest of our system. We're trying to get it to calm down. So keeping kind of easy through our legs. You can stay here and hold and breathe. You can also start to oscillate. So thinking of little kind of pulses back into the ball really gently. That's going to get a little deeper. And then the last thing you can do is kind of roll around. So you hold the ball in the spot, but you start moving off it. So, as you get lower into deeper layers, sometimes lateral flexion, sometimes coming a little bit forward and back. So the muscle actually has to actively, or you're pushing against the active muscle movement. So this is how we can do that for the spine. That goes anywhere from the top of the head down to about mid-sacral level here. So if we're looking to get any soft tissue work through the backside of the glutes, so our hip complex, we can take one lacrosse ball. Lacrosse ball is going to be a little bit harder than tennis ball. Tennis ball is a little bit softer, but the same exact thing. So we're going to take ball to the wall, and then you're going to find that area anywhere from the top of that hip crest down to the bottom of the gluteal fold is on. It's good. It's off, or it's not off limits, I should say. So you can roll through the entire area. Once you find a spot again, you can stay there. You can hold. You can oscillate back and forth into the wall, or you can start adding in that range of motion. So we know glutes do external rotation, they do abduction, and they also do extension. So going into flexion extension, going into abduction, adduction, or turning the hip in and out, that's going to add a degree of difficulty and maybe discomfort onto the ball in a good way. When we think about soft tissue manipulation or any kind of ball massage, we're never doing that in isolation. We know that we have to understand why there's tension in the body, and we want to dissipate it with adding in some functional exercises, getting that strength back so that we can maintain the length-tension relationship that is optimal for our system. So you can have these tools, filter them into your home exercise program, and 3 to 5 minutes should be enough. You can always do it throughout the day if it's a little bit of a salve, but again, never in isolation. We're always adding these in with the rest of our stuff.